I guess if you prescribe dutasteride, then you have to be on it yourself. Otherwise, you really shouldn't be prescribing it. Is it that way for every medication? Yeah, without further ado, I guess we can get into our stack. Some of you that are listening to this may have listened to us talk about whether or not we're on dutasteride. Because I guess if we're not on dutasteride, then I guess if you prescribe dutasteride, then you have to be on it yourself. Otherwise, you really shouldn't be prescribing it. Is it that way for every medication?
Used to be.
That's how most clinics are. You know, OB-GYN or urologist or family doc reaches a certain age. You know, they're mid-50s and never prescribed hormones of any sort before, but for whatever reason, they decide to start HRT themselves. And then they split off, they have their own little clinic, and they prescribe the same hormone regimen that they happen to be on. Whether or not that's more good or bad, that helps a lot of people. And otherwise, the demand would be nowhere near, or the supply would be nowhere near meeting the demand.
But unfortunately, it's not a one-size-fits-all. Not everyone can just fix their iron deficiency and regrow their hair. So I guess for your regimen, how do you address, I guess, A, androgens in general, like testosterone, and 2, DHT, which is still the biggest lever that most people are able to pull, assuming you can utilize it over a long period of time?
Yeah, it's a great question. It would be a lot easier if I was female. But since I'm male, I do like to have a slightly higher total androgen pool that we've talked about in the past than I would if I was female, most likely. Females also benefit from testosterone and androgens, as we've talked about. But there's a couple different ways. So I'll kind of talk about these 4 main categories, and we'll post a graphic or an image of some sort that kind of breaks them down. But it's an anti-androgen, whether this is topical or systemic. This is a growth agonist, fertilizer, if you will. But this could be many things. It could be anything from growth hormone to minoxidil. And then microtrauma, or of various sorts, is microneedling. You could potentially even put laser into this category. And then blood flow or hypoxic tissue damage prevention. So basically anything else that improves blood flow. This could be tadalafil.
Exercise?
Yeah, exercise is a good one. I didn't put in like autoimmune issues in this case. I didn't put in like specific nutrients that would be addressing pathologies. I didn't really talk about thyroid in this category.
So let's assume that you have a euthyroid state. You're not iron, selenium, zinc deficient. Kind of check off those boxes. Make sure you're not blackballing yourself.
Yes.
And then you can look at these other vectors.
Yeah. And I'm not taking Nutrafol or any other overly expensive. There goes our Nutrafol sponsorship.
Wah.
Yeah. Or any other kind of like poor value per what you get multivitamin for my hair. But I do check my vitamin status and I make sure that my thyroid's optimal. I check my ferritin. I have 2 hemochromatosis, 2 HFE SNPs, 2 of the 6 that are kind of commonly checked. And ferritin doesn't run high a ton, but we'll get into that a different day. But yeah, I guess I'll start off with my stack when I am not desiring fertility within the next 6 to 12 months. And then I'll go into my fertility stack. If I am desiring fertility within the next 6 to 12 months, it's extremely different. And frankly, a lot of the patients that see us that both want to keep their hair and have healthy babies without potential theoretical epigenetic risks, that's a lot of them because usually they're not going to come to us. They'll go to one of the billion, there's about 1 billion different cookie cutter telemedicine hair loss. They can't call themselves clinics, but like services that connect the patient with the provider. Yeah.
And we talked about it previously. It's not going to, in most cases, cause infertility, but if you want the highest number of the most healthy sperms competing against each other, which just sounds great to me, then you probably want to avoid these things in that 6 to 12 month period prior to conception. So what's your non-fertility hair loss stack?
Yeah. As mentioned previously, I do like taking dutasteride, usually twice per week. And now when I'm completely done with fertility, because it's kind of off and on without going into too much detail, I will take daily dutasteride. I love how my skin is on dutasteride. I have relatively few CAG repeats. I'm looking at my heart pretty closely too, and I don't want a hypertrophic cardiac muscle, which given that I'm just given my body phenotype, tall, heavy, already borderline in some of the echocardiogram parameters. Dutasteroid's kind of another benefit for me there. And then extremely strong family history of prostate cancer, including metastatic in relatively early ages. And also arguably still like already some prostate symptoms in my 30s. I like that. I like how I do on dutasteroid quite a bit. For me, literally just testosterone is more enough androgen for the androgen pool. And yeah, the main downside of why I'm not taking daily dutasteroid right now is because it's going to take longer to wash out and to have those theoretical epigenetic changes and also intratesticular, people call it intratesticular testosterone. It's really just intratesticular androgen receptor activation, go back to normal. Yeah, I should, when I'm not in a fertility period, I should also probably still be on ketoconazole. I'm not as good at it when I'm not, but I don't add in things past that.
Yeah, and you did do an experiment at one point in time, a combination of, I guess, technically 3 different anti-DHT, nutraceuticals or pharmaceuticals.
Yes.
So maybe we rehash that a little bit. So this is the most DHT blockade you had ever done.
Yeah, so the most I've ever done, for a period of, I think, 6 weeks, I took daily dutasteroid, 0.5, daily finasteride, 1 mg, daily saw palmetto. I think the total daily dose was something like 1,200 mg.
Yeah, usually 320 is what's used in the studies, sometimes slightly higher than that.
Yeah. It was, I think it took about 4-ish capsules per day.
Or megadosing, macro dosing.
Yeah, I was already on dutasteroid and finasteride, so at that point I was adding it in. And I knew I wasn't getting a whole lot of inhibition out of it, no matter how much I took. And that's really the most. And I think I was still taking that intelligent volumizing shampoo, which I call ketoconazole shampoo, because it has 0.99% ketoconazole. It also has pumpkin seed oil, peppermint seed oil, I think a little bit more saw palmetto, probably not absolutely necessary, but some people like it to be in there, and topical caffeine, actually. So that's my max anti-androgen stack. It was more of an experiment, and I felt great on it. I don't think I've had side effects from any of these things. Perhaps my urine stream was a little bit easier.
Too powerful.
Well, probably not too powerful, but just a little bit easier. Since I've had a good amount of hair regrowth, especially in my crown, compared to, I think I started finasteride first 5 or 6 years ago. I'd say, yeah, I've likely made up some ground from things other than the scalp. I've always been very prone to acne, even late into my 20s. And unless I'm on HCG, then it's generally not too bad.
Yeah, I think that's a pretty good overview. So you've been on as little as no anti-DHT vector, and as much as 3 different vectors to try and suppress DHT.
Yep.
How about growth agonists for yourself personally?
Yeah, when I'm not in fertility phase, none. So, I'm pretty happy with the thickness and density at this point. I don't see a reason to add, a GHRH or BPC or GHKCU or minoxidil or latanoprost or any of these other kind of like growth agonist fertilizer category things. If I take one for another reason, then I do see a bit faster growth of hair, but I'm not taking one specifically for hair.
Yeah, and I think that's a really reasonable approach. A lot of times people are doing this in the opposite order. They're putting in the growth agonist first and not necessarily addressing the androgen component to the hair loss. Yep. So you may see really good improvement for 3 months or 6 months, and then you take slow steps backwards because you're not really addressing and like giving yourself a higher ceiling of how much hair you're able to maintain. So I think seeing what you're able to get out of just addressing the DHT component, give that a good 6, 12 months, even longer sometimes.
Yep.
Really solid approach. How about micro trauma?
Yeah. When I'm not in fertility phase, I also do not do that. I really should. When I am in fertility phase, I do like to get PRP, Microneedling when possible, especially if someone can use salon grade microneedler like a skin pen, like the one we have for our aesthetics procedures here. That's great. Intelligent also has a good microneedler. I really should add it, but again, in general, I don't. I guess I could say I'm a little overly happy with how things are because I'm not optimizing as much as I was early on when I was good with microneedling. Back before Intelligent had their pen, I'd use the Derminator. And now it's just not necessary for me at this point. Although alternate universe Kyle that would never take any anti-androgen despite having a really good androgen pool. And instead, if I had started minoxidil 5 or 6 years ago, my hair would be nowhere the same quality now.
Yeah, so you would be outpacing current Kyle those first 3 months you're on minoxidil.
Yep.
And you'd say, hey, I don't need to do anything else. And then as you're running that race, you have kind of the tortoise versus the hare.
Yeah, my hair would have peaked in high school. Or, my mid-20s.
Yeah.
Anyways.
Not that you were in high school in your mid-20s.
Yeah, I was homeschooled, so I definitely did not peak in high school.
Yeah. Next, you have blood flow. So I understand you do a fair bit of exercise that's good for blood flow.
Yeah. Yeah, and on top of that, fairly often I take 2.5 mgs tadalafil. Not directly for the hair, more so they don't get up and pee at night. I like drinking a lot of water. I try to do the trick where you don't drink more than about 3 ounces every 20 to 30 minutes the last couple hours of the day. But yeah, I don't like to wake up because I feel like I need to urinate, and tadalafil helps me not do that. I probably take it an average of 2 or 3 times a week. I'm supposed to take it every other day, but
every three and a half doses per week.
Yeah. Anyways, that's kind of the full stack for non-fertility. As you can see, other than the Intelligent ketoconazole shampoo, I do not like topicals whatsoever. I just like to take an oral, and if I'm going to do something, then I want it to have excellent efficacy. If I'm going to put time in, I'm thinking microneedling, that'd be the one thing that I'd add in next.
Yep, great overview.
Yeah, I guess it's a good transition to my fertility phase, which is not too dissimilar.
Yeah, so fertility phase, what are the big changes in the androgen or anti-androgen category?
Yeah, no dutasteride. And, if depending on the dose of dutasteride, if I've weaned down to 1 pill of dutasteride per week, around 4 to 6 months before desired potential conception, I'll remove that and I'll just go to the topical ketoconazole Intelligent shampoo. And I guess technically the topical caffeine is kind of maybe that too, some topical pumpkin seed oil maybe, but really it's mostly the ketoconazole driving that anti-androgen. So I definitely have progression of miniaturization when I'm in these phases. So that's why I do a lot more and for everything else.
Yeah, other ancillaries such as under growth agonists.
Yep, I like my PRP. I guess I'm somewhat lucky to have you or one of the nursing staff to inject PRP or microneedle it in, ideally both.
Yeah, very convenient.
So yeah, that's a great thing to use as kind of like a temporary plug. Occasionally, for also other reasons, I will use systemic GHKCU, not the foam. But if I have like an Achilles tendonitis, that's definitely not from CrossFit, then I might use that. If my IGF-1 is running like 120 and I'm trying to be a little bit leaner in the summer, and again, I'm trying to lead to help heal up, like maybe a rotator cuff tendinopathy, again, definitely not from CrossFit. I might be on some Egrifta, which is tesamorelin, and that's also a growth agonist. So between the GHKCU peptide and the tesamorelin, I do notice a bit more growth. I just don't think it's, it's an added benefit. If I'm not taking it for another reason, then it's not going to be in my stack.
Yeah, and any growth hormone or growth hormone secretagogue is going to be pro-fertility as well. Yep. So you're not necessarily taking, growth hormone for hair loss. It's for other purposes, and then hair loss is a side effect that just happens to be a positive side effect of such.
Yes. So as I mentioned, I'm better at microneedling and doing scalp injections and basically everything else just because I'm a little terrified of having a huge regression. I'm okay with just a little bit.
Probably because with higher DHT, you actually have the motivation to do it.
That is definitely not it. No, it's just pure fear. Like Maddie says, I'm the world's biggest hypochondriac. But when I address something, then I feel very at peace. So I think about my health a lot, but I actually almost never worry about my health because I just know.
Yeah, one of the pros of being a physician.
Yeah, that's definitely true. There is a little bit of healthcare provider privilege, really.
Yeah, I think it's like if you work in healthcare, you're going to be in a much better position than the average population. And I think we've made the comparison before, whereas if someone works in finance, then you would think it would be the same, where they have a bit of a advantage about how to manage their money and get into investments early and being more savers versus spenders, because they kind of are doing this for a living and managing people's wealth accumulation. So they kind of have a leg up on the general population when it comes to what you can and can't do there.
Presumably they should know how, just like athletic trainers should know how to train to improve physical fitness and body composition.
Yeah.
That's really it for my hair loss stack. If there's any specific questions for mine, I suppose you can just ask and I'll do my best to answer. But I don't think it's overly complicated at all.
No, quite simple.